What is the best way for women to regrow their hair? Hi, I'm Clarissa from OurDoctor, and I'd like to talk to you ladies about the best remedies to regrow your hair and prevent your current hair from falling out. It's important to know that hair loss is a pervasive problem for women, much more so than people realize. Research shows that at least 1 in 3 women will suffer from hair loss or reduced hair volume at some point in their lifetime. More than 20 million women in the US are born with androgenetic alopecia, the most common hair loss for males and females. In women, hair loss usually starts at the top of their head or near the part. Their hair tends to first thin and then become sparse so you can see the scalp. Hair loss usually starts in your midlife, usually after the age of 40, but this can also occur earlier in life and may continue. Female pattern hair loss is a common hair condition in which women characterized by diffuse hair thinning over the crown and parietal scalp with retention of the frontal hairline. The prevalence of female pattern hair loss increases with advancing age, which affects up to 50% of women during their lifetime. The only medicine approved by the FDA to treat female pattern baldness is Minoxidil when applied to the scalp. Minoxidil works quite well for women and has been shown to help hair grow in about 1 in 4 women. For women, doctors recommend the 2% solution or 5% foam. Women who have tried the foam have seen upwards of 81% regrowth in their hair. Liquid Minoxidil in 2% and 5% solutions are available over the counter and can be found at your local drugstore. But expect to wait around 6 to 12 months to see results. And you'll need to keep using Minoxidil to maintain the effect or it'll stop working. Your hair may return to its previous appearance. However, if you notice any side effects such as redness, itching, dryness, or unwanted hair growth in areas on the cheeks or forehead, consult your doctor or reduce the percentage of Minoxidil. What are the top reasons for hair loss in women? In women, hereditary hair loss usually starts after the age of 40. However, roughly 40% of women have noticeable hair loss by age 50, and less than half of women get through life with a full head of hair. Hormones play a significant factor if you are experiencing hair loss and are very common after menopause and after childbirth because of the rapidly changing hormones. After childbirth, this hair loss usually happens because you're a new mother in which you may see your hair fall out in clumps. Hair loss usually occurs shortly after this childbirth, about 2 to 6 weeks after the birthing. If you have not had children, look for the following medical conditions: thyroid diseases, anemia, which is low iron in the blood, ringworm, which can spread from person to person and can cause balding, infections or high fever, radiation and chemotherapy for cancer, an autoimmune disease called alopecia areata. It makes your body attack your hair and leave round bald patches. Hair starts to fall out from the middle of the scalp and fans out, leaving parts of the scalp smooth and shiny. It is scarring alopecia. This more often affects African American women, diabetes, birth control pills, blood thinners, and some steroids. A sudden shock that most have experienced can lead to telogen effluvium. This is usually defined when you see a large amount of your hair fall out while you comb or wash it. If you are experiencing additional stress in your life that is more than usual, this can also trigger hair loss. Some also experience a condition called trichotillomania, linked to suddenly feeling the urge to pluck hairs off your head, eyebrows, or other body parts. The reason why people do this is to relieve their frustrations and burdens, which cause stress. Another cause of hair loss is your diet and nutrition. For example, if you lose weight fast but deprive your body of its foods and supplements, this can be a factor in why you have hair loss. But if you suffer from anorexia, in which you restrict your diet, or are bulimic, which is when you purposely vomit after eating, this can also trigger sudden hair loss. Consider using a supplement such as Peak Body's Hair Growth Support for women. This product supports hair strength, health, and growth and contains biotin, silica, and collagen. The suggested use is 2 tablets daily, preferably with meals or as directed by a doctor. This product contains no fillers and is non-GMO and GMP certified. Other stimulants for female hair growth include androgens such as testosterone, DHT, androstenedione, and DHT sulfate. If you are experiencing additional hair loss, here are a couple of tips to consider when taking care of your hair besides changing your hairstyle. Foremost, if your hair is not in its natural state, this can cause severe damage to the follicles. An example would be if you wear your hair in braids or a ponytail for a long time. You also want to stay away from flat irons and high heat blow dryers. Also, do not use harsh chemicals such as bleach or perm. Limit how often you shampoo and condition your hair. Even overcombing wet hair can cause damage to the follicles and lead to falling clumps. Consider getting a diagnosis if you cannot figure out your hair loss. Your doctor may consider doing additional blood tests to ensure your levels are intact and rule out thyroid problems. Your doctor may also examine your scalp and do some tests, including a biopsy of the skin, a pull test to test the hair strength, and check for any infections or swelling of the primary hair loss area. Similar issues with mass shedding or telogen effluvium would occur if you went there in a highly stressful or traumatic situation. Some traumas could be extreme weight loss, losing a loved one, or even childbirth. Because of this, you want to consider taking a supplement like Peak Body's formulation to give your body back the nutrients it needs to stop this hair loss and regrow your hair. What should you do if you are using the treatment prescribed by your doctor and are still not getting the results? Even if you use a combination of Minoxidil, Rogaine, finasteride Propecia, or dutasteride Avodart, you then want to get an additional checkup from your dermatologist to look for any inflammatory scalp conditions such as eczema or an underlying health condition such as an autoimmune condition. When taking prescription medications, monitor your hair growth as side effects such as headaches, hot flashes, fatigue, electrolyte imbalances, spotting between periods, irregular menstruation, tender breasts, or a decreased sex drive may occur. Also, taking a diuretic such as spironolactone can block your body's natural androgen production, which is vital for hair growth. If you need additional answers, you may be referred to different specialists to examine your blood work or to another doctor who specializes in endocrine conditions or a tumor on the ovary gland. So what does female pattern baldness look like? In female pattern baldness, your hair's growing phase slows down and can become non-existent. First, you will notice it takes longer for new hair to grow. As your hair follicle shrinks, your hair shows signs of being thinner and finer. This will result in hair that breaks more frequently and with little ease. With female pattern baldness, you will also shed more hair than the average person. Men tend to bald in the front of the head, then recedes to the back of their head, while in women, it usually starts in the part line, then towards the top of the scalp in patches. Other options for female hair growth: recently, there has been an increased use of laser combs and helmets that have been approved by the FDA to treat hair loss. They use light energy to stimulate hair regrowth, but more research is needed for its effectiveness. Another therapy called platelet-rich plasma therapy has been developed. This treatment involves drawing your blood, spinning it down, then injecting your own platelets back into your scalp to stimulate hair growth. About 75% of females get good results when opting for this treatment. A hair transplant or graft is a more permanent solution in which your surgeon will take a thin strip of hair, usually on the back of your scalp, and implant it in an area where your hair has gone missing. You could also consider a wig or a hairspray product to conceal your hair loss, but this is just a temporary and not a permanent solution. Other options include ketoconazole, corticosteroids, and hormone therapy. But also taking iron, biotin, and folic acid has also been great in promoting thicker hair. These ingredients like omega-3 and fatty acids are in Peak Body's formulation for women. I hope I have given you ladies some advice on regrowing your hair quickly. However, there is still so much more to know. Make sure to ask our doctor any additional questions you may have, as we'll be happy to answer your questions promptly and thoroughly. Thank you for watching our video today. Good luck, and make sure to like and follow us if you want to see other videos like this. Bye!